Is there an infant or toddler in your life who you are concerned about having possible autism or maybe having some delays, and you're not really sure what to look for, what to do? Or even if you have an older child with autism or you're a professional in the autism field, you might get questions from neighbors, friends, nephews, nieces, um, and you might be wanting to have a little bit more information so that you can um, give really good advice if somebody approaches you with concerns. Today, I'm interviewing Dr. Erin Michaud, who is an autism researcher. She is the principal investigator for a baby infant study up in Boston. We talk all about developmental delays in babies, possible signs of autism, and ways that we can begin to turn things around or reverse some of the biomarkers. For some kids, we can teach cooing, we can teach babbling, we can teach pointing, and what to do if you're noticing any delays or getting questions about infants or toddlers. So let's get to this really great interview with Dr. Erin Michaud. Well, I'm excited to welcome Dr. Erin Michaud to the show. Thank you so much for joining us, Erin.
Hi, Dr. Barbera. Thank you for having me.
Oh, you can call me Mary for sure.
Okay, Mary it
So,
is.
and I'm going to call you Erin throughout. So it's going to be a great conversation, all about developmental delays and autism, possible autism in infants and toddlers. I know you're an expert researcher. You're also an SLP and BCBA D combined with a PhD. So a lot of great background. But can you just tell our listeners in a minute or two about your journey of how you got into this whole world of being an autism researcher?
Sure. So I started out as an SLP, and when I was looking for jobs, I found a school for children with autism, and they were looking to hire, and I was really interested and didn't know much about it and didn't know anything about ABA. So I looked into it and I started there thinking I'd be there for about a year or two. And I completely fell in love with both autism and ABA. So I was working with teenage boys around that time. And I decided to get my BCBA. And I got my BCBA. And then I started working with little ones. So under 3, we called it our home based division. And then they offered the PhD in behavior analysis. And I thought, why not? I found an advisor, Dr. Amanda Karsten, who had very similar interests to me, and that was EIBI, so early intervention and language. So I was able to sort of merge my speech and language background with ABA, and it really worked out nicely having those similar interests. So I worked as a speech pathologist, then as the assistant director of the team, the speech pathology team, then as the assistant director of the EIBI team, and then Dr. Becky McDonald, who headed the project, the infant sibling project we'll talk about later, she retired last year. She still consults to us, which is great, but she asked me to take over her project. So I'm the principal investigator of that project. So I'm mainly a researcher now, but I'm still able to work with the little ones, infants mostly, and do assessment and treatment and parent training, which is my favorite part and what I ended up doing my dissertation on. Because as you know, it's so important to train parents.
Yeah, yeah. Well, that sounds great.
Yeah.
And you told me before we started the show that initially as an SLP, you hadn't heard about words like manned and tact, and somebody gave you my first book, The Verbal Behavior Approach, which was like 18 years ago, you said. So, yeah, we've been on similar paths to trying to help kids over the past, 18, for me, 25 years. Um, but I think we should maybe dive into the sibling project just a little bit to give our listeners some perspective. So I know when Lucas was little,
Mhm.
um, I had, Spencer 18 months later. There was no sibling studies or projects or whatever like that. But when I became a behavior analyst in 2003, there was the siblings the sibling project started. So I don't know what year that was, but I know from my perspective as a parent, some of my clients who had kids with autism and then were pregnant or had tiny babies, they chose voluntarily
Mhm.
to enroll in the Autism Sibling Project at Children's Hospital
Mhm.
Philadelphia, which is our closest hospital, or Kennedy Krieger. So I know this is like a national research, but can you just tell me and the listeners just a minute or two about that project and like what it entails and who it's for?
Oh, sure. So you're right. There's so many, different projects going on with siblings. A lot of them are looking, genetic testing and things like that. And we're looking directly at markers of autism. So if you have a sibling with autism, you're around 20% more likely to have autism. So we have our what's considered our high risk group. So siblings of those with autism. And then we also have a low risk group. So children that don't, or babies that don't have any siblings or history of autism. And we're extending the research done by Gropner and Salos in 2017. And they found around 2 months you can determine some of these markers of autism. And
Hmm.
what we're doing is going out every 2 weeks from as early as 3 weeks old straight through 18 months. And we're looking at the same things over and over. We created early markers of autism assessment. Dr. Becky McDonald and Catherine Kruger created it. And it's 24 things that we look at, starting from 1 month on. And it's some of the
What are the things you look for?
yeah. So early on, we're looking at, is the baby looking at mom or dad or their caregiver, looking at the face right around, 1, 2 months. Are they cooing? Are we seeing that cooing back and forth? And having the background as a speech pathologist, we learned, babies coo, and that's something they're supposed to do. But seeing and having been in so many with so many babies now, it's really amazing the back and forth or reciprocal cooing that they actually do. So when we're not seeing this, it can be alarming. So we're showing parents how to do that, how to get that to happen, how to get the babies to look, at you. And basically, what we do is show a parent how to, have fun and really interact with their baby. So if a baby isn't looking, for example, and they're looking up and looking at a light or looking at a fan, we say, let's go to a room where there's no distractions, nothing behind you, and find what your baby loves. Does your baby love when you sing? Does your baby love when you make silly faces or smiles? And, what gets your baby to want to look at you, without those distractions? And it's so rewarding, when it happens for the parent and the baby, of course. And, one thing leads to another. So when they're looking at the parent, then we can start out with some of this, reciprocal cooing and showing them how to make noises back and forth and tracking their face and, things like that.
Yeah. So I'm sure it's pretty stressful for parents
Mhm.
who have a child with autism. They've enrolled in the study and you come out. Are you saying they're not doing enough? We need to work on this, or are you just I can imagine it's like very stressful.
It is, it's, parents disclosed to us, they said, a lot of parents didn't know their first child, say, had autism. Even, they might have been pregnant when they found out. And they said, now we found out, our new baby has a greater chance. And there's a lot going on, for these parents. So we really try to point out, like, the great things the babies are doing. And what's so rewarding is showing them, yes, we are looking for cooing and we're not hearing it, but here's, ways to help it to happen. And it usually does. We're able to get those things to happen, which is so helpful for the parents. Is then cooing leads to the babbling, and then and so on and so on. But you're right, it is stressful for the parents. And we get a lot of videos. We tell parents, if you see something you're concerned about, send us a video if it's in between our visits, and we'll respond if it's something that we think is fine, because our parents are nervous. We tell them. If it's something that is alarming, we tell them to call a pediatrician or come right out and try to help them with if it's more related to autism or something that we can help treat.
Yeah. I'm sure you're familiar with the work of Dr. Ami Klin out of Emory. And in my Turn Autism Around book, I talk about the work of Ami Klin and his, work with kids who end up to have autism being like highly fixated on certain objects and movement and not parent faces and everything. So I did do a podcast we can link in the show notes about his work and his findings, which are very much in line. And the other thing I want to say, in terms of teaching parents how to get into a quiet room without a ceiling fan and to work on cooing or work on pointing or work on babbling, that's very much in line with my book, my courses, and all my work, because I know we have a pointing bonus video in our course. Like, you can teach kids to point.
Yep.
You shouldn't have to, and it does make them at a higher risk if they are not pointing naturally. But, pointing is an important skill, attending, cooing, babbling. And if the child is getting off track at whatever age, whether that's an infant or a toddler, there are a lot of things you can do.
You're right. The point and the gestures are so important. We see oftentimes it's not happening. So we're showing parents, and it's great to know you have a course too, because parents do want more, and pointing is great when it happens. Some of that, what is it? And just gestures overall. And you mentioned what we call kind of sticky attention. So, just fixating on an object. That's one of the things what we look at. Can a baby, when we hold up a red ball, does the baby look from the red ball to us? And usually they do right away, or from one object to another, from a noisy object to another noisy object. So
yeah,
those are things. Yeah.
So, and you follow the babies for a long time, like years, right?
We do. So we see them from birth to 18 months every 2 weeks. And we do that EMA I mentioned. And we do quarterly assessments too. So we do the ADOS, the Mullen, and we go over the CDC milestones. And at 18 months, if everything looks great, we don't come back again until 24 months, and then again at 36 months to do that full battery. But we always tell parents after 18 months if there are any concerns. And, there has been, parents that call and say, my child stopped doing this or that. We come right out and assess and, tell them how to move forward.
Yeah. Yeah. Some other video blogs and podcasts I've done have been on the ADOS, so we can link that. And then an episode on the CDC milestones when they changed the CDC milestones a couple of years ago with Dr. Cheryl Tierney.
Right.
That as well. And then, kids like my son Lucas have regressed. They had skills. They were cooing, they were sing-songy back and forth. He was waving, he was pointing, and then he regressed. And it wasn't even like a sudden thing. It was just like, oh, it's just like a phase. He's not saying hi to the camera anymore. And, so I'm sure that some of your work also picks up kids that look okay early on, or do they look bad early on and we just missed it?
It's a great question. What age did you notice the regression with Lucas?
Well, in hindsight, it was after his first birthday, but he was always kind of liked TV a lot, you know. Um, but he would say hi, he would
Hmm.
wait, but looking back, it was like a year, 15 months, he became pickier eater, he got more addicted to the pacifier, his sleep was poor, his diet, he was refusing foods, and then I was also pregnant with my second son. So like where you said, some of your parents are pregnant and then
Hmm.
they don't even know. And so it was my son's lack of reaction to
Yeah.
the new baby at 18 months, which alerted my husband, who's a physician, to question the possibility of autism. And
Right.
that's when I told him it's not autism. I never want to hear the word again, and went into a deep state of denial.
Hmm.
But it was confusing because, I mean, I also have videos at 2 where he has joint attention. He's
Hmm.
clapping and looking, and, so like he went to typical preschool when he was 2 by himself without I mean, he was quiet.
Hmm.
They had concerns mid-year, not that he was, aggressive or doing anything, but he was just not really participating, wasn't, moving forward. So I
Right.
think it's not, for many parents listening, these delays are up and down, like
Hmm.
can't be like, well, my kid points or he has eye contact, he's definitely not autistic, or they're passing all these early tests with flying colors and it's definitely not autism, because just never know, like.
That's exactly, what we're finding. So we're finding 3 profiles of babies with our high risk group. So those that don't show symptoms, and go on never to get a diagnosis. Those that show symptoms very early on. So in those first 6 months, we're seeing that, they're not looking at mom's face or dad's face, they're not cooing, some of those things. And then with treatment, again, we go in, show the parents, they look, those symptoms go down. And, after 12 months, they go on not to receive a diagnosis. And then we have our later onset profile, and just what you described, very few markers early on. And then around 12 months, we're seeing some of those things go away, like the point, some of that joint attention that they may have had, or some of that babbling that they may have had, then going away. And so that's our third profile. And those are our kiddos that do end up going on to get a diagnosis and get that very early treatment, which is, one of the main objectives of the study, is that early diagnosis, early treatment.
Yeah, yeah. So I did in 2023 in the fall, I read an article, a journal article with 210 kids, 213 kids in Boston. And I did a podcast episode on that. And I named my podcast episode, Can You Outgrow Autism?
Mm-hmm.
Because the study showed that kids in Boston, there were, over 200 who were diagnosed between 1 and 3 years of age. When they were retested at between 5 and 7, 37% of them no longer qualified for the autism diagnosis. And I did a solo show. I sent the recording to the lead author of that paper, and she responded pretty soon, like the next day, and said she listened to it, very spot on. Um, and so I know you're familiar with that kind of work, but like even my book called Turn Autism Around, which the subtitle is super important, an action guide for parents of young children with autism. A lot of people are like, what do you mean turn autism around? You can't turn autism around. It's not, curable, or,
Mm-hmm.
you know, and really it's not about turning autism around. It's about turning speech delays around, turning joint attention around, turning tantrums around, turning, fine motor deficits around, imitation. Um, but how do you respond when people say like, you know, they don't like this, trying to cure kind of attitude?
Right. Yeah. We try to stay away, like you said, from those, words like cure or lose a diagnosis, and we just speak to what we're seeing. So, we were seeing these symptoms, and, a year later, we're going out and, testing using the ADOS, and we're no longer seeing these particular symptoms. And we treat to what we see. And if we're not seeing it anymore, like you said, are we, no longer seeing a speech and language delay, or we're seeing greater joint attention, that's great. And there might be things that always are there that are indicative of autism, and that's okay too. But what we're looking at specifically, that's what we talk about.
Yeah. So it is your research, and I know you're just in one of the sibling studies. Do you know how many sibling studies are related or together throughout the United States?
So ours is standalone.
Okay.
Yeah, there are many different, like I mentioned, genetics, different things, but this one, is the first of its kind, that is looking that early on every 2 weeks directly in the home, as
And
far as we know.
what is your project called?
The Sibling infant study. And we have a couple of different names, as far as when we're going to publish it. We also have the EMA, so that's the assessment, so the early markers of autism, infant sibling study. It might change, but as of now, that's what we're referring it to.
And that's
Right.
located in Boston.
Yes. So we go about pretty much all over Massachusetts, seeing families.
Right.
Any family that has a child or a baby under 3 months of age and has a sibling with autism will include in the study.
Mhm. So if listeners are obviously not going to be from Boston,
Yeah.
so my best advice, if you wanted to participate, if you have a child with autism and you wanted to participate in, contact, search, autism sibling studies,
Mhm.
and then Philadelphia, PA, or Boise, Idaho, or whatever. See if you can find a study nearby, within an hour or two. And then, because some of these aren't the same as Erin's describing. Some of these are, you go in and you get assessed at different points.
Mhm.
And, some of them, I know, Cody's mom with her middle daughter, I think she said that she could have an MRI, where some people would be like, no MRIs, you know what I mean?
Right.
So
Right.
you don't have to like go full tilt and be constantly under a microscope, but I do think that it's worthwhile. It's worthwhile to at least be aware of that your sibling would be at higher risk just naturally, and not just for autism, to about 20% for autism, and then even more so for just a language delay, right?
Right. So we have, a lot of families that have heard us at conferences and whatnot contact us and, ask, can my child be in the study that's, and they're in Florida. So we send resources like we mentioned, we talked about before, the CDC milestone tracker. So they have a great app, and you can track exactly, what you should be looking for in language, physical, social, emotional, cognitive, all the domains. And it keeps track of it for you. If you're not seeing some of these things, it's something you can go to your pediatrician with or contact your EI. That's usually what we pass along to parents so they can keep an eye themselves.
Right. And not even just for families with autism,
Right.
because and now, and I was actually a part of this movement to train pediatricians to have pediatricians offices have parents do screening tools like the MChat at the 18-month and or 24-month visit. I believe it's still at both, but you know I talk about that in my book. I have a
Mhm.
video blog. We can link that in the show notes. But it's important no matter who's out there. And I know we even have, parents of teens and things listening, and you might be like, well, this is information is not pertinent. It actually is,
Mhm.
because you have neighbors, you have friends, you have nieces, you have great nieces, you're going to have grandchildren, hopefully, um, in every and because you have a child with autism, or if you're a professional working in the field, you are going to get people asking you information. It's just that's the way it goes. And so for you to be aware of of keeping your head above the sand and just being aware, and also being aware that this doesn't, just because they have a biomarker doesn't mean it couldn't change. And
Right.
just because your child appears to be, severely impacted does not mean that that's the way it's going to go, or
Right.
vice versa. And so I think we're just both very much aligned with, let's just find your starting point, whatever that is. And that's a moving target, like you have to get reassessed, and just help each child get to whatever point they can, right?
Right. And it's a great point. Some of our parents say they've become sort of the voice for autism in their community because they have children already. So their friends and neighbors are looking to them for advice and help. And it's great for them to be able to help too. It feels good for everybody.
Do you find from your research that um in a baby, or even in a young toddler, that speech delays look different than autism, than signs of autism?
Um, so what we really notice, if it's just a speech delay, we see the social aspect there. So lots of eye contact, lots of gaze shifting, that joint attention, gestures. So, they're bringing us and the families into their social interactions. They might just not have that speech and language yet. So we're not hearing the babbling. They don't have their first words, but otherwise they're very, very social. And that's sort of how we define the difference. Whereas at 12 months, we wouldn't recommend they go get a diagnosis or an evaluation. We'd recommend they contact EI for speech and language services.
Yeah. 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 And I also think, and like, you're the SLP, so I could be wrong, but if I'm looking at a 1-year-old or an 18-month-old,
Mhm.
like speech delay versus possible autism, um, a couple things. The speech delay child will tend to have better receptive abilities.
Mhm.
Touch your head, go get your shoes, that sort of thing. Where if you have both an expressive and receptive, I feel like, and lack of imitation, that's another big, the point, of course, pointing to the sky, that's what you're
Mhm.
saying about social joint attention. But a lot of people don't think of a point as being part of a social thing, but it's very important, like your gestures, the pointing to the sky to show you an airplane, or the bringing the stuffed animal over,
Yeah.
or if milk gets spilled, looking at you like, oh, we got a problem, even if they're
Right.
not talking, just following your point. Those sorts of things are really important. And the other thing, that I learned while I was reading this, while I was writing my book and the chapter on picky eating, which we just covered last week in the show, all about the 7 steps for picky eating, is that, and I don't have the stats right off the top of my head at the moment, but kids, if you have a 1-year-old or 18-month-old, and they're both speech delayed, and one is an extreme picky eater, their chances of having autism also are much greater, based on a 2019 study.
Oh,
Yeah. So that's actually in my book in chapter 10, and it's on last week's podcast. So you're going to want to check that out as well.
yeah, absolutely.
Yeah. And then, feeding and talking kind of, uh, a lot of times are, merged. Like,
Right,
if
right.
a child's not talking, how are they eating? What are they
Mhm.
drinking? Are they addicted to a pacifier? All those kind of things are important.
That's right. Yeah. We ask the parents, about eating and sleeping, and we go through just general questions to see, just
Do you
looking at the
find
whole child.
you find from your research that kids that have the autism markers or go on to get an autism diagnosis are more temperamental, have more tantrums?
It's interesting as we've talked about this, and anecdotally, we're seeing, both sides of that spectrum. So some parents report, yes, definitely. And then other times parents say they were so easy, they didn't seem to notice or care about much, and they were just the most easygoing child. So we're seeing both,
Yeah.
which has been interesting.
Yeah, and my Lucas, my son with autism, was very laid back.
Right.
He was not a temperamental child. He
Hmm.
didn't have major problem behaviors. And then some of my clients with moderate to severe autism, they look laid back, but it's also the, and I was guilty of this too, especially because I wasn't a behavior analyst, so I had no idea. But, they look laid back until you try to present, soft foods on utensils, or you try to make them wear the blue shirt and when they want to wear the red shirt. So there's like an overcompensation to keep them calm.
Right. We
So
don't realize, right, what we're doing at home to, yeah, keep
yeah,
the peace.
yeah, but that is interesting because there's
Yeah.
also, besides the markers, besides your developmental milestones, besides what you're doing, there's also the child's personality and how, you know, how laid back or high needs they are in terms of you know, sensory input. I mean, there's so many factors, right?
Right. Yeah.
Just so confusing.
Yeah, you're right. And even with sleep, again, we see both sides. Some parents say, their child really had difficulty staying asleep, falling asleep, no naps. And then we have other parents that say they've been worried about their child because they sleep too much.
Yeah.
You know.
Yeah. And I have a new webinar now, and it's like my looking back at both my kids, like I was so kind of consumed by Lucas and his needs. But Spencer was 18 months younger, and Spencer was chronically sick. And
Mhm.
because he was chronically sick with ear infections and tonsils and adenoids out by the time he was 3, and, he didn't sleep well. He was a
Mhm.
picky eater like Lucas. And it's like he was obsessed with trains. And, you know, nobody has a crystal ball to go, like, how do we know how he's going to do? I was worried about, would he regress like
Right.
Lucas did? And now my crystal ball is he's a physician, my younger son. And
Yeah.
Lucas still has moderate severe autism and needs, 24-hour supervision. So it doesn't mean if you're concerned about an area that it's going to end up to be autism, but we just need to, whatever the issues are, I think, tackle them, right?
That's right. That's exactly right. And, like you said, parents are concerned, especially, having a sibling that, if we see something that it's going to turn into autism, and it doesn't always. Like you said, we treat what we see and take the whole child into consideration.
Yeah, yeah. So your parting advice, I'm going to ask you one more question, but for parents out there, and we have parents listening from all over the world. So if you're concerned, what should you do?
Contact EI, or your physician. But if you don't have an appointment set up with your pediatrician, I think it's a common misconception that you need a referral to contact your local EI provider, and you don't. And what we've found is that EI providers are very open to come out, especially, if you do have a sibling, because they're aware of the research too. So they're willing to help.
Right.
So look at those milestones, get on that CDC app tracker, and if there's concerns, call the EI, and it never hurts.
Yeah. So EI is early intervention. So
Mhm.
you can search early intervention plus your city and state or country. And attend a free workshop with me, read my Turn Autism Around book, and really start assessing where your child's at. Do my free digital assessment. It's still free, marybarbera.com/assessment. We'll link that in the show notes as well. So find your starting point. Don't panic. eyes wide open and start making progress to help your child and see where you end up.
That's great.
So thank you so much for all of your wisdom. Before I let you go, part of my podcast goals are not to just help the kids, but help the parents and professionals be less stressed and lead happier lives. So do you have any self-care tips or stress management tools that you use?
What I try to do daily is get outside. I live in New England, so it's not always warm and sunny, but something about being outside in fresh air helps me to feel better, helps me to be a better mom, a better wife, better at work. So fresh air and sun.
I like that.
Yeah.
All right, cool. Well, thank you so much. It's been really nice to meet you, and I wish you all the best with your research. It's very exciting to have very well qualified SLP BCBADs working on the research to really help not just the kids now, but our kids in the future. So thank you so much for your work.
Oh, thank you for having me.